world still stumbled from the after effects of the waves of the COVID pandemic, the population collectively realized a need for the abolishment of complacency and a requirement of preventive measures. India, a country with a population of 1.36 billion people, has been hit by relatively worse waves as compared to the world. And much of it comes down to the lack of knowledge of basic hygiene. While we are still steadying ourselves from the second wave, which is devastating, a change does seem to have taken over. However, a sense of uneasiness still lingers on. It may not be about the pandemic itself anymore, but about the change that has taken place through necessity. A question begs to be asked here now. Has COVID-19 acted as a catalyst for increased hygiene standards in India? Hello everybody, I am Anirudh, a third-year medical student studying at Goa Medical College. I hope you all are safe and keeping well. Before we dip our feet into this ocean of a topic, we need to understand what hygiene is, why it is important, and how India went about it before the pandemic. According to the World Health Organization, that is WHO, and I quote, hygiene refers to conditions and practices that help maintain health and prevent the spread of diseases. The importance of hygiene is not only health related, it has social and mental implications as well. One's body image can be impacted by hygiene. One can simply be of a better mindset after being hygienic. Apart from that, obviously, a plethora of diseases can be prevented by following simple hygiene routines. India is a country which is plagued with many concerns such as dowry, illiteracy, rampant cases of TB, and this makes us known globally for all the wrong reasons. Recently though, it has been changing. For example, the government policies such as Swachh Bharat, which gained global traction, and the National Rural Drinking Water Program have been a step towards achieving qualitative and quantitative justice in the aspects of water, sanitation, and hygiene. According to UNICEF, in the last 6 years, India has seen a tremendous increase in sanitation and hygiene, with about 450 million more people having access to all the facilities needed for proper sanitation and hygiene. Now, at a glance, it seems that our country fared well in terms of progress, but the pandemic really gave us a perspective about the areas we lacked in. India struggled to tame the second wave of the pandemic, which was greatly attributed to the lack of facilities, awareness, and absence of general public hygiene. The answer to the question at hand, the question I asked right in the beginning, can loosely be divided into 3 categories. That is, hygiene at the level of healthcare workers, hygiene at urban populations, and at rural areas. Hygiene at healthcare workers has always been stringent, as most of us could have guessed already, and it was followed fairly well before the pandemic as well. Many studies before 2020 showed a general idea that maintenance of it was always carried out with minimum barriers. Even then, there were cases of new personnel lacking basic knowledge in the hygiene aspect to be maintained at centers. The reason here can be cited as the lack of driving factor, which further did not incentivize strict following of these policies. More than anything, the SARS-CoV-2, that is the coronavirus, has created a necessity for the application of all protocols and standard operating procedures. A recent study conducted at hospitals in Gujarat showed that doctors and technicians working at the tertiary healthcare center were driven by fear due to an alarmingly increased rate of death due to COVID. A majority of the faculty noted about knowing the hand washing technique and following it regularly. This trend was not surprising at all given that the healthcare workers had faced the pandemic head on, and certain studies after that showed that fear was a very important factor in driving psychological and the mental stress the workers face. Even among students, a majority of the number was seen to be apprehensive at the lack of proper hand hygiene. Personally as well, I have seen a surge in the increase of I have seen a surge in sanitizers, rather the usage of sanitizers in all wards at the hospital I study at. All these reports point towards an increased sense of hygiene in healthcare workers, and a study conducted in September 2020 corroborated these findings. Only 10% of the infected population was healthcare workers as of September 2020, which is significantly lower considering it was 21 to 26.3% during the SARS pandemic. The severity of it was also 3 times lower than the general population. Now, the reasons for these numbers are exactly the answer here. However, the list is not exhaustive. The workers had access to all the facilities, and being healthcare workers, they had basic knowledge about hygiene and how the disease progressed. So, because of that, the numbers were significantly reduced. Of course, as I've said before, this does not imply and will not imply that the main causation for the decrease in numbers was only better standard of hygiene. It wasn't. Interestingly though, it becomes clearer as we talk about urban population and the socio-economically backward strata. Now, it is no longer a secret that the major brunt of the pandemic was faced by the people in the rural areas. The subpar access of water and soap, amongst others, stood out the most as the causative agents. According to World Bank data, rural India has only a meager 49.6% of the population having access to water and soap. And even in this pandemic, the number hasn't risen at all. This abysmal state can be associated with the deprioritization of the water, sanitation, and hygiene project as other important pending matters overloaded during the pandemic. While masking in general has increased, the people from rural areas barely have access to them, and hence it creates further problems. The lack of water is also a major deterring factor in the maintenance of necessary hygiene. Now, we have always known that urban areas have been far better than rural areas. But how better are they? What is the number? And why are they better off than rural areas? In urban areas, the access to water, the population which has access to water and soap is a staggering 30% more. That is, in rural areas, since it was 49.6, in urban areas it is as close to 80%. Now, why is it so? This disparity can be attributed to mainly 3 reasons, which are cultural reasons, social reasons, and economical reasons. All these statistics and data really shows us only the quantitative aspect. What we need to know is the qualitative aspect as well. The change in the mindset of the people is also something we need to consider before we form our opinion and advocate for the better. I just have one more statistic to provide, so please bear with me here for a minute. Now, when I came across this statistic, it completely blew my mind. Not because it was something unexpected, but because I possibly couldn't have fathomed the magnitude of this statistic. Ever since India has been hit by the COVID-19 pandemic, the production of sanitizers has gone up 1,000 folds. Now, to put it in simpler terms, that is to put it in numbers, before the pandemic, India produced 10 lakh liters of sanitizer per year. And now after the second wave, that is after the 1,000-fold increase, it produces 30 lakh liters of sanitizers per day. The increase in the production of sanitizers also means that there has been an increase in the demand for sanitizers. And it gives us a really useful insight as to how the people have started thinking about something as basic as hygiene, and how it has been revolutionized by this pandemic. But alas, this all seems too good to be true. And in this case, it is in a way too good to be true. Because even after this 1,000-fold increase, 50% of the population still does not have access to sanitizers. And of course, it is mostly the rural population which does not have access to it. Now, when I started out with this question, I had as much knowledge about it as any other person would have had. What started back in 2020, what has stolen many livelihoods, has possibly done what no other government, no other NGO or any leader could have done. It has changed the mindsets of people regarding water, sanitation and hygiene. A sense of morality now resides in being frequent washers of hands, in wearing masks regularly, in following social distancing, and in following the standard operating procedures given by the government. The answer to this question, the question being, has COVID-19 really been a catalyst for increased standards of hygiene in our country, is not something we can just come up to with one discussion. It will keep changing as we get more data and a better perspective. One silver lining though, which we surely cannot ignore, is that COVID has given us a new line of thought. A new line of thought even in the older and the more rigid generation of people. The only way we have now is to move forward and to advocate for the underprivileged, what we privileged people already have, and act for the betterment of the society as a whole during these trying times of the pandemic.